You're watching Virginia This Morning. This segment is sponsored by Bon Secours Heart and Vascular Institute.
Coronary artery disease is the #1 cause of death in the United States, affecting more than 13 million Americans. Cardiologist Dr. Brian Kaminsky joins us this morning to reveal how new technology and procedures are changing how heart disease is being treated and saving lives. Doctor, it's great to have you.
Good to be here.
This can be a very broad topic, but at the heart of it, we're talking today about chest pain and recognizing some of the signs and what you should do, and then new advancements. Tell us, what causes a patient to have chest pain?
Chest pain coming from the heart is typically caused by a severely blocked artery. So when you exert yourself, the heart doesn't get enough blood flow and it hurts. Now, in the advanced stages, blockages of 90% or more, the blood flow is reduced at rest, and the patient may have chest pain just sitting still.
Is there a difference between an acute chest pain and a chronic, maybe long-term chest pain situation?
Yes, an acute chest pain is more of an urgent, potentially life-threatening situation which needs to be attended to promptly. Chronic chest pain also needs attention, particularly if multiple arteries are blocked involving a large portion of the heart muscle.
We've been talking a little bit before we got started this morning, and for a lot of patients who may have already received a diagnosis, even as recently as last year, it can be a different situation this year due to some of these new advances and technologies.
Yes, over the past 5 years, there's been quite a bit of progress, particularly in two settings, people with very weak hearts and people with completely blocked arteries. 5 years ago, there wasn't a lot we could do for either one of these groups. Someone with a weak heart would do their catheterization, we'd see everything blocked, we'd see a very weak heart, and we'd say, gosh, I don't think we can do anything, it's too risky. And we'd ask the heart surgeons, okay, what can you guys do? And they'd say, we can't do anything, it's too risky. Well, now, routinely, we have a pump device that we can put in to assist the heart, and we can take these people back to the cath lab and open up all their arteries with stents while their heart is assisted by the pump. And we do this with a high degree of success. We do this on very weak hearts. And typically, once the blockages are open, the pumping function improves. And often by the next day, we'll see a big jump in the pumping function.
That seems really profound. I mean, to go from not being able to do anything and having to be turned away to now there's hope.
Yes, it's really, the pump provides a security blanket, because when you're working on them, you're blocking some of these arteries even more temporarily. And when the heart was so weak, you couldn't get them through the procedure.
For folks watching today who may say, well, that was me, what do you do? Do you just pick up the phone and call your office and say, I think I need to be looked at?
When we identify patients like that, yes, typically we'll see them in consultation.
If you identify that they are a candidate for this to happen, what should they expect? How does a process like this work? And you said recovery can be fairly quick.
Yes, typically someone undergoing this procedure would come in the day of the procedure and often go home the next day or the day after.
Wow. Dr. Kaminsky, you must be pretty excited about this being a reality these days.
Yes, it's very satisfying to help these patients.
Absolutely. Well, thank you very much for being with us. Appreciate it.
Glad to be here.
We're going to share a little information. You can take action now. For more information, contact Dr. Kaminsky's office at 730-1481.
All right. Well, thank you so much, Jess. Valentine's Day right around the corner.